Semen analysis. Patient information. The man should be given clear written and spoken instructions concerning the collection of the semen sample. The primary recommendation is ejaculate collection by masturbation. Coitus interruptus is not recommended and should only be used in exceptional cases due to the risk of incomplete collection and contamination with vaginal fluid and cells. Unique condoms for fertility investigations may be an alternative in extraordinary circumstances. Still, the entire ejaculate will not be available for examination, and the specimen is likely to be contaminated by contact with the skin of the penis, and to some extent also vaginal fluid and cells on the outside of the condom. Contraceptive condoms cannot be used due to the presence of spermicidal agents. Ordinary latex condoms must not be used for semen collection because they contain agents that interfere with the motility of spermatozoa. Lubricants should be avoided since they may contaminate the ejaculate and change its properties. If absolutely necessary, validated non-spermatotoxic lubricants must be used. The ejaculate needs to be wholly collected, and the man should report any loss of any fraction of the sample. The ejaculate should be collected after a minimum of 2 days and a maximum of 7 days of ejaculatory abstinence. To avoid exposure of the semen to fluctuations in temperature and to control the time between collection and analysis, it is recommended that the sample be collected in a private room close to the laboratory. Ideally, investigations should commence within 30 minutes after collection, but at least within 60 minutes. Individual exceptions can, of course, be necessary, and each individual should be given proper advice on possibilities and risks. If not collected near the laboratory, transport must not allow the sample temperature to go below 20 degrees Celsius or above 37 degrees. Suppose the patient, for any reason, must collect the ejaculate at another place. In that case, the specimen container should be kept close to the body under the clothes, for instance, in the armpit during transport. It should be delivered to the laboratory, preferably within 30 minutes after collection and at least no longer than 50 minutes after collection.